Welcome to our slideshow presentation, Dorothea Orem, The Self-Care Deficit Nursing Theory by Vincent and Jake Lundquist.
History of Dorothea Orem. She was born in Baltimore, Maryland. She was the youngest of two daughters. Father was a construction worker. Her mother was a homemaker, and she's one of America's most notable nursing theorists.
Education. Orem focused on teaching, research, and administration. She went to Seton High School in Baltimore, graduated in 1931, received diploma from Providence Hospital School of Nursing in Washington, D.C., got her bachelor's at Catholic University of America in 1931, and a master's in nursing of education at that same university in 1945.
In 1976 and 1980, she was awarded an honorary degree of Doctor of Science. In 1980, she also was awarded a CUA Alumni Association Award for Nursing Theory. In 1988, a Doctor of Human Letters from Illinois Wesleyan University. In 1988, Linda Richards Awards. In 1991, a National League for Nursing. In 1992, Honorary Fellow of the American Academy of Nursing. In 1998, Doctor of Nursing honoris causa from the University of Missouri.
Work history. She held many positions. She was a private duty nurse, hospital staff nurse, nurse educator, director at School of Nursing and Nursing Service at Detroit's Providence Hospital. She then moved to Indiana, where she served on a board of health. She assumed a role as a faculty member at Catholic University, later becoming acting dean.
Orem's theory. Orem created a grand nursing theory that is divided into three theories: theories of self-care, self-care deficit, and nursing system. Nursing system encompasses self-care and self-care deficit. The theory of self-care is a component of self-care deficit. Developed the self-care deficit theory as a result of working toward improving the quality of nursing in general hospitals in her state. First published self-care theory in 1959. However, Orem continued to develop her conceptual model over several decades.
The theory explained. Orem's theory is essential to the assessment of a patient's ability to provide self-care. The nurse provides essential care where the patient's ability is lacking. Each person has a need for self-care in order to maintain optimal health and wellness. The purpose is to provide increased self-esteem for the patient. This also promotes and preserves functionality of the self-care abilities. This theory promotes varying levels of independence. Each person possesses the ability and responsibility to care for themselves and dependence.
This image depicts the contributing factors and the patient's abilities and inabilities, which dictates nursing care and patient's needs as a whole.
Developing the self-care theory. Determine ability of patient to provide self-care. Development of nurse-patient relationship. Factors considered such as gender, age, environment, developmental status, and healthcare needs.
The meta-paradigm concept encompasses person, environment, health, and nursing. The person, an individual with physical and emotional requirements for development of self and maintenance of their well-being. The environment, client surroundings, which may affect their ability to perform their self-care activities. Health, structural and functional soundness and wholeness of the individual. Nursing, the acts of specially trained and able individual to help a person or multiple people deal with the actual or potential self-care deficits.
Scope. The self-care deficit theory explains when nursing care is needed, and this is generally when the patient is unable to care for himself. This theory encompasses everything from the patient needing full care to the patient needing education in order to meet his self-care needs. We've included a picture of a scope.
Implementing self-care deficit in healthcare provides complete care or acting for others. This is when the patient depends wholly on nursing care because he is unable to care for self. Then there's providing guidance. Sometimes the patient may be able to care for self, but needs direction on what to do in his particular situation. Providing support. Sometimes the patient needs to know someone's in their corner to assist them as well as provide guidance to them in their times of need. And then there's providing a positive environment for the patient. In order for the patient to be able to care for themselves, they must have all the necessary components to do so. This can include assistance from sources such as social workers and close family. And then provide teaching. Teaching is not only guidance, but education to provide on their particular situation.
How this is implemented in education. It can specify when nursing is needed. Nursing is required when a patient is incapable or limited in the provision of continuous, effective self-care. The 5 methods of helping are acts of doing for others, guidance, supporting care, providing a constructive and healthy environment to promote wellness and future demands, and education.
Implementing Orem's theory of self-care deficit in research. Assessment is collected in 6 areas: health status, perspective of health status, patient's perspective of health status, patient goals and provider goals of health, patient needs for self-care, capacity to perform self-care. Nursing diagnosis and plan with scientific rationale. Design system that is full assist, partial assist, or supportive education. Organization of components that are therapeutic to self-care demands. Modifying combination care that will promote effective patient self-care. Implementation and evaluation. Provide assistance where self-care deficits exist. Promote independence. Collect data supporting efficacy of plan in regards to self-care deficits. Evaluate data, modify, and improve so patient can provide optimal self-care.
Personal experience of using this theory, somebody who has a full assist, somebody who's physically incapable of self-care at any level. You're performing their ADLs, bathing, toileting, feeding, dressing. You're turning the patient. This might be somebody in the ICU who's on a vent, and you're having to maintain their homeostasis.
In patients who are partial assists, they don't always require hospitalization. They can sometimes be found with home health or sometimes in the hospital. Usually these patients require assistance with activities of daily living, wound care. The goal is to promote independence as much as possible.
And lastly, people who only require education and guidance. These are people who are just overcoming knowledge deficits to their self-care. They might need knowledge on medication and medical equipment education and training, like how to use a glucometer. Adaptation to impairments to overcome daily challenges, like somebody with a below-knee amputation learning how to walk. They need to recognize signs and symptoms of when to seek future care or medical services.
How does this theory shape advanced practice nursing? Self-care deficit theory is a grand nursing theory which covers a broad scope of general concepts that can be applied to all instances of nursing. This theory can be utilized in advanced practice by using the components of basic conditioning factors to improve patient outcomes after discharge. This theory can benefit a therapeutic relationship between provider and patient by utilizing an assessment of physical and cognitive abilities of the patient. From the evaluation of abilities, patients can be encouraged to become independent where possible to promote a sense of health, well-being, and ownership of self-care.
This has been fun.
Thanks for watching, guys.
Bye.